Good morning, and welcome. My name is Dr. Bryan Call. Today, we're going to be talking about biohacking your recovery and performance through hormetic stress. This is going to be a bit of a whirlwind, so hang on and stick with me. We're going to go through some physiology and some concepts that may be new. Give you a background on myself. I am a national instructor with Hot Grips, instrument-assisted soft tissue mobilization company. I'm on the medical advisory board for Morozco Forge. They are a deliberate cold exposure company, and I was the former chief scientific research officer for CBD Healthcare. Currently, I own and operate my practice in Hood River, Oregon, at the base of Mount Hood, where I work predominantly with extreme sport athlete professionals, kiteboarders, snowboarders, mountain bikers, Olympians, and such like that. And then just everyday normal people who want to come in and optimize their body through some biohacking. So biohacking, what is it? Maybe you've heard of the term, maybe it's new to you. It's taking control of your own biology so that you can make your body do what you want it to do. Sounds nice, right? That's the phrasing that Dave Asprey, who's largely accounted as the father of biohacking, has said what it is. His background was actually in computer science. So he is used to, quote unquote, hacking like a computer, where you can take the hardware of the guts of a computer and repurposed some of the software so you can optimize the effects of what the computer is capable of generating or creating. And he took that basic conceptual idea and then began to apply it in his own physiology, in his body. We can basically, our hardware, our bodies are able to be hacked and optimized so that we can have a better outcome. And one of the ways that he found that was most heavily utilized was the process that is called hormesis, or a hormetic effect. So hormetic stress, or hormesis, is an acute stressor that stimulates a favorable and beneficial adaptive response following brief exposure. So maybe the term's new to you, maybe you're familiar with it, but if it's new and you haven't heard of it before, that's okay, but you are familiar with the concepts. So here's some examples of hormetic stressors. Exercise, that's a hormetic stressor. Basically, we're putting our tissue under stress for brief moments that causes, on a microscopic level, typically tissue degeneration, cellular damage, and it triggers a reactive adaptive response from the body that increases tensile strength, recovery, growth, and causes the tissue to be stronger and better. Down on the left is some instrumentation work that you can see breaking up scar tissue and moving lymphatic fluids. That will cause an inflammatory reaction, but it helps to increase blood flow, break apart scar tissue, it increases range of motion. And then if you pair that with a topical CBD or cannabidiol extracts you can put on there, you can really handle the inflammatory reaction that you're creating with the physical exertion of going and breaking up some of that tissue. And then up here, you'll see a good old Joe Rogan sitting here doing his recovery in an ice bath. Ice baths are a wonderful hormetic stressor that they trigger a variety of effects in your body, one of which is a massive reduction in inflammatory chemicals. And it triggers your body to stimulate more energy and repair. Wonderful for recovery for anybody, especially professionals. So this process of biohacking through hormetic stress, there's many different routes of biohacking. This is just one protocol and processes that you'll go through. Your exercises, which you guys are amazing at doing, all the athletic trainers, HIIT exercising, the high intensity interval training, has incredible effects on the body, and particularly it's stimulating some protein compounds that cause better neuroplastic reaction, better information into the brain to help that person perform better and continue to do so. The instrumentation, eye stem work helps to increase range of motion, increase perfusion, washing off some of the inflammatory chemicals. CBD topical, rather than working just on a mechanical reduction of inflammatory chemicals, it now begins to work on a chemical side. So you get kind of this 1-2 punch that it can work in synchronicity with the body's ability to handle more inflammation. So then you can be able to stress it and recover faster than you did without it. And then the ice bath is incredible at finishing and closing off those sessions. And if you're lucky, we don't have the time to go over too much of that today, but you'll be able to do contrast therapy, which is ice and then going back and forth between ice and hot, like a sauna, to be able to maximize the inflammatory reductions and controls. So the goal here is what we want for all of our athletes is we want to decrease the damage caused by their inflammation while they're in their recovery process. Want to increase that recovery so that they can do it faster, they can recover better, they can have more energy, and then they can begin to perform at that higher level, particularly in those moments like games or clinch times when they need that optimal performance. So we need to increase energy through these recovery processes. As we increase the brain response, that increases better performance. More energy in the system means more capacity for the brain to interpret and reroute new neural connections and networks. So that means better performance overall. So these are some of the goals we want to achieve with this biohacking and utilizing hormetic stress. Now, I don't want to give all inflammation a bad rap because there is good inflammation. It's important. It's useful. It's part of the body's protection mechanisms to heal in response to traumas, toxins, pathogens, etc. Without acute inflammation, short bouts of it that comes through, even tiny little things, bruises, small cuts and stuff like that, could potentially be life-threatening if they never were resolved and they continue to prolong. And if you didn't have inflammation, you could never actually get hypertrophy. You could never strengthen the tissue because it wouldn't happen. You need inflammation to build muscle from our exercises. That being said, there is a lot of bad rap that goes with inflammation, and that only becomes a problem when it becomes chronic, when it becomes unending. So that is at the root cause of many life-threatening disorders and diseases: cardiovascular disease, cancer, diabetes. Right now, those three alone account for almost 70% of all the deaths in the United States. And the common link between all of those different disorders is inflammatory reactions. That's the common thread. So the more inflammation, the more sickly your body becomes, more prone for disorder and disease and breaking down of tissue. Inflammation blunts energy production in the body, and it also does that in the brain. And so less brain capacity means less ability to react and respond. So performance is going to go down. So in a typical treatment cycle, you have an injury, you got some joint pain. What's the first thing that you're often handed? NSAIDs, right? You give them some ibuprofen. They continue to work harder, same or increased pain, boom, stronger NSAIDs. Maybe they take a look at it with some x-rays and make sure that the structure of the bone and the alignment is all right. Finish it off with like a cortisone shot to suppress the inflammatory reaction and help you feel better so you can get back out onto the field. If it doesn't work from there, then maybe send you in for an MRI to take a peek at the physiology of the structure. Are there pathologies? Are there tears? What's going on? And if there is, maybe you fix it up with arthroscopic surgery, or worst case scenario, you have to go in like a full-blown surgery. So typically you start with like the NSAIDs. So let's take a quick peek at those really quick. In the physiology, if you imagine this was a slab of muscle. All the guys in the theater here, the individual seats would be a cell, for example. And then we've got our arteries and we have our capillaries, which are smaller networks of cardiovascular input. Inside there, we've got a number of things flowing around. We've got our red blood cells. Those carry our food supplies for all of our cells to operate and to activate. And then at a much bigger size is we have our white blood cell. which is our immune reaction, but it is also our guy who comes in, fixes and patches damaged tissues. So we've got our red blood cells flowing along, and you can see in the arteries, they can stack on each other, multiples, creating an ample flow. But when it starts to come down to the capillaries, what often happens is, because they're tiny little spaces, that it will flow just about single file through those spaces because it is very tight in those vessels. So if you had cellular trauma to that, say this guy right here got some repetitive injuries, maybe he had a slip fall, tore something. Whenever there's injury in the cells, they basically start waving flags and sending out signals to the body that, like, hey, I'm hurt, I need help. And that is the inflammatory chemicals that get released to trigger the repair process. So it's not the red blood cells, but the much bigger and better at repair white blood cells that come to the rescue. But as you can see, the capillary bed's not quite as wide as the arteries. So the inflammatory chemicals create the spacing to allow these guys to come in there and do their work, do the reparative process. So inflammation, going back to that there is good in the inflammation because it does stimulate the reparative agents and processes of our body to grow and become better. So when you're taking NSAIDs, it suppresses all inflammation. There is not a capsule that is a right knee inflammatory pill. You suppress inflammation across the entire body. And when you do that, you could better name these let's stop the healing drug, because that's exactly what these chemicals do, is they're going to suppress the body's capacity for healing across the whole system in effort many of the times to just stop the painful reaction and response of what's going on in the body. So what pain meds really do is they just alleviate the nerve signaling to the brain or spinal cord, but they don't address the tissue damage that can continue to generate over time. They do not heal or regenerate anything. NSAIDs are linked to ulcers, heart attacks, and upwards of 15,000 plus deaths a year in association with them. So what do we do? How do we handle some of those inflammatory reactions? And what is actually else going on with the inflammation in bad effects? It releases little tiny proteins called cytokines. Cytokines are the ones that stimulate that reaction that we were just talking about. When they are unchecked, that's when you start to get oxidative stress. It can blunt the mitochondrial energy production. Mitochondria, if you remember back into biology days, they were the quote unquote powerhouse of the cell. These are our energy producers for our body. They are our the battery pack that allows us to continue to function and our athletes to optimize and run at a high level. Overreactive inflammation also traumatizes our gut bacteria. Gut bacteria is our immune system. There's so much that happens in there. Anybody who's had a GI disorder distress knows that they are very important. But it also deals with a number of neurotransmitters. A vast amount of our neurotransmitters are produced in the gut, and if we're off, that can cause problems. They can affect our hormones. Out of control inflammation can get our hormones out of whack, our testosterone, our growth hormone, things like that. And that is all going to trigger us to be more prone and susceptible to injury and diseases. They also, when you have prolonged inflammation, it lowers our energy because of mitochondria being affected. That increases our cortisol, our stress hormone. Increased levels of cortisol lowers a very valuable and important protein called BDNF, brain-derived neurotrophic factor, which we'll talk about in just a minute, which every professional athlete needs to know and understand how to maximize this for their increased recovery and repair. So mitochondria, these guys, they are all the energy producers in the cells. They're the guys who make it happen. They literally control all of our energy, our performance, and our recovery. So in short, we want a lot of these dudes. We want them highly tuned, active, and producing a ton of energy for us from their little factories. Inflammation is going to make them less efficient. So we want to maximize the environment for them that they can be able to produce. Now, as trainers for working with professional athletes, this is where you guys excel. You guys are so good at catering exercises and programming for these guys to stimulate these repairs and development into the body. One of the things that happens when you do exercise, and especially the HIIT, the high intensity interval training exercises, is you release a chemical called PGC-1 alpha. And that helps regulate metabolism and creates something called mitogenesis. That's the creation of new mitochondria, those little energy producers. So this stimulates the creation of the protein BDNF, brain-derived neurotrophic factor. We talked about that earlier, that high levels of cortisol will lower this compound in our brain. So why is this important? So one of the researchers out at Harvard, he called it miracle grow for the brain, is because what it does for the brain is it causes neuroplastic regeneration. So it creates new tendrils, fibrils that come out of the neurons to connect and interweave other neurons. And as they talk about the neurons that wire together, or that fire together, wire together. For a professional, it's that 1/100th of a second. It's those tiny little pieces of gaining cognitive control over their brain, over their physiology and body that make the biggest difference, from the top level athlete to the guy who doesn't play as much as everybody else. There's not a humongous spread at that level. So when your brain is not inflamed, it can work more clearly, and it can control those muscle movements more adeptly, that they're more intuitive, more reflexive, because there is a larger network having control. So instead of having a couple of them go offline, you've got many, many backups. So BDNF is something you definitely want to increase in your athletes. Exercise improves circulation, which that's good because that delivers more oxygen to the mitochondria, which means more brain and body energy, but it also creates a washing effect. These chemicals, these cytokines, they're an acid. Just like any acid, the longer they sit on a tissue, the longer they irritate, the longer they burn a tissue. And so mobilizing them mechanically, just through the fluid dynamics of circulation, is something that you definitely want, so that it gets pushed along and doesn't sit on particular cells for extended amount of time, so that it can cause that muscle tenderness or negative reactions. This is one of my favorite biohacks and treatment modalities for patients. It's instrument-assisted soft tissue manipulation. So basically what it is, you're using an instrument to glide across the tissue to break apart restrictions. It'll increase blood flow, again, stimulating a wash of those chemicals and increase nutrients and supplies to the tissue. When we are damaged, when we've got inflammation and any traumas, we lay down a protective barrier of something called type 3 collagen, and it's a brand of scar tissue, so to speak. It'll decrease range of motion and blood flow. And since now that the lymphatics aren't pumping as well because we've got restrictions, the blood flow decreases, that means inflammation is not being wicked away. It's not being washed off as readily as it had before. So inflammation now lasts longer, causing an increased negative effect. So this therapy gives an immediate reaction response. So any of you who've had this therapy understand that, like, you almost immediately know a range of motion difference. It can be uncomfortable at certain moments, but then you get up and you feel amazing. Lots of blood flow. You get that histamine reaction response, the reddening of the skin that goes onto it. And this can accelerate healing and performance, even after just basically the first 1 or 2 times. Now, that's a mechanical process that happens during this treatment. Now, if you were to add a chemical compound, now you can really dial in a compound effect. You can begin to maximize some of those effects, not just on a physical level, but on a chemical level too. So if we look at some physiology here for a second, we've had some traumas happen to this joint. Those would be represented by the stars. Any trauma that triggers the inflammatory reaction, like if you go to the gym, you work out really hard, you get what? Calluses. The body's natural defense mechanism for too much trauma, too much inflammatory reactions, is to lay down protection. and specifically collagen. So we get a lot of collagen deposits when we work out really hard on the outside of the skin, but it's not that different from the outside to the inside of the skin. The tissues inside get damaged and the body lays down that type of scar tissue, the type 3 collagen. It is not flexible. I don't know if you've got scars anywhere on your body, but it doesn't feel like normal tissue. It doesn't perfuse, doesn't have blood flow like normal tissue. It's a lot less mobile than traditional tissue that is trying to structurally recover and repair. So it increases your risk of injury and decreases the range of motion wherever it gets laid down. So these little spider webs right there, those are our representations of that type 3 collagen. Now from those injuries, we've got collagen deposits. That means less blood flow, which means more inflammation building up into the area that is being restricted because there's less perfusion. When more inflammation builds, one of the things that happens is lots of chemicals get spit out to trigger the reactions in the body. And unfortunately, one of those is nerve firing that sends a lot of alert to the brain of, ouch, this sucks. So utilizing instruments to break up some of the scar tissue is a wonderful mechanic to begin to separate some of the type 3 collagen and potentially break it up, increase blood flow, which will then begin to decrease some of the inflammatory chemicals and mediators. And as those begin to go down, the output of chemical stimulation and of the nerves firing that there is pain to the body begins to go down, making your patient much happier, and then they can function and perform at an increased level because their body is able to be coming back more to a static normal. So why would you add CBD on top of the mechanical process? So in a normal acute inflammation, there is regeneration that happens, and it is a regular deposit of collagen and restructuring of our tissues. But when we have chronic repeated stresses, which athletes continually have because they're constantly training and exerting and pushing their bodies to those limits, so they're going to be chronically inflamed because they're always continually utilizing those tissues and pushing it, and it's going to cause breakdowns. And so when that happens, there is an abnormal and a considerably higher amount of reaction in those inflammatory chemicals. When you add a CBD to our practices for recovery, then they can begin to modulate some of the effects and blunt some of those chemicals on a chemical basis, which can potentially shift from an aberrant regeneration of collagen, that type 3 collagen, to a more normal pattern of regeneration and secretion of those compounds. So that's what you're hoping for when you're adding into this, not just the pain and inflammation control, but that you're shifting the direction more to a normal repair instead of a holy cow, we're in crisis mode, we need to lay down the extra collagen just to stabilize where we're at. So processes for optimal results with this is apply it to the skin. Cannabinoids are awesome at absorbing through the skin. They're fat-based. We absorb fat-based really well. We're kind of hydrophobic, so we don't get watered in as well, but we do well with the fats on the skin. The active effects can begin in as little as 15 minutes. It lasts for about 2 to 6 hours, depending on your liver and how well you absorb it through your tissues. And then you reapply as needed. Now, this is different than, for example, BioFreeze. You put BioFreeze on, it's mentholated, it feels great. Notice an effect almost immediately. Cannabinoids have to build up almost like a level inside of your system before you really notice big effects. So when someone puts it on and be like, no, I don't know if I noticed anything. It's because we didn't give the cannabinoids deep enough time into the tissue to actually cause the physiological effect that you really want. So on an acute situation, I recommend 2 to 3 applications a day. And then you really start to see some of those compounding effects 3 to 4 days deep. So continue that effect until you're through the recovery process. But it's really that 3 to 4 days deep of doing that 2 to 3 applications really before those cannabinoids start to make the big changes and effects onto the system. That's something that a lot of people erroneously do with topical CBD. On to my next and one of my most favorite hormetic stressors is deliberate cold exposure. Got Ben Greenfield right there sitting in his ice bath, a wonderful guy full of a great knowledge, swears by the ice baths. Some of the reasons why is the cold stimulates, again, that really important protein PGC1-1 alpha. This is how doing the cold therapy creates new mitochondria. Also, that was created under the high intensity interval trainings. And so we want to create more mitochondria. More mitochondria equals more energy, equals more brain power. That means more reactive reflexive control over our body, higher performance, better recovery, athletes like that. So this will dramatically stimulate circulation because it causes all the vessels to constrict and send heat back to our core. So it radically flushes fluids into our body, mostly to the core, just to conserve the heat, because the body is not able to think. It can only reflexively respond. And so it knows, it's like, well, we do need a liver, but we don't need toes right now because the environment is too cold. So it's shunting and mechanically driving all of that fluid that might have some of those cytokines and interleukins that are causing problems into our system back to the core, back to be filtered by our liver and our kidneys and excreted and released. So that lowers the cytokine concentration, and it also can stimulate a variety of neurotransmitter and hormone reactions, even down to testosterone increases. So quick recap, brief durations of stress causes our body to heal stronger and better. That's the hormetic stressor. That's the term called hormesis. When we are able to control our inflammatory reaction, we're able to reduce it. And especially if we can do it in a natural reaction that we don't put ourselves at an additional risk of damaging some of our systems, we can increase recovery and then boost our energy production in our physical body. And then also, really importantly, in our brain, because our brain controls all of our processes, all of our reflexes, all of our performance. So we working on those mitochondria. The highest density of mitochondria anywhere in the body is in the brain. Unless you're a female, it's in the ovaries. Besides that, it is in the brain. So stimulating an increase in blood flow, whether it's exercise, cold exposure, the mechanical process of ISTEM, that can decrease our cytokine and inflammatory reaction and increase proteins like the PGC-1 alpha and the BDNF that can heal our brain and our body overall. So in short, exercise, ISTEM therapy, CBD, ice, these are all your friends. So some tips. So with going into the ice, it is not a gentle, easy process when you begin. So starting slow it's not a big deal. There's no shame in starting slow and getting to it. It's a letting go exercise. It's not a competition to see who can stay in the ice the longest, who can be in the coldest. It's just about doing it. Just start doing it and you'll see the results, just like anything else. Consistency is much better than high amount in a single duration. So here's another great tip that you can do for your athletes, or just for you in particular, is have your inflammatory levels checked by a functional medicine doctor. So get your blood drawn, check for substances like C-reactive protein, CRP, or homocysteine, and LP-PLA2 that are good markers to review for inflammation in your body, so you can kind of see where you stand. And those are objective, they are measurable, and they can be altered and shifted. And a lot of these processes that we talked about, a lot of these hormetic stressors can radically shift your levels of these compounds in your body. CBD topicals tend to be more effective than localized treatment for inflammation than oral CBD. Topicals go right on to where they need to go. They do pass into it. They don't go systemic, so they're not going to give you a full body effect. They are just local, which is also a good thing too, because then you're only getting it really where you need it. Oral and systemic CBD is effective, but it is difficult to dial in, and it does require an abnormally high amount of CBD to go into your system because of first pass destruction that breaks down the compounds, and then the absorption depending on your liver uptake pathway to actually get it to cause a physiological effect. So it does become difficult to do, and it does become cost prohibitive, where topical CBD relatively inexpensive, and it begins to cause pretty noticeable effects in just a short period of time. So thank you guys very much for having me on today and talking about some of the things that I do in my clinic. You guys are awesome. Highly respect Matt. Thank you for bringing me on and being able to come share a few minutes with you. If anybody would like to contact me, feel free. It's my office number, website, Instagram, and email. I'd love to connect with anybody who wants to talk physiology and recovery, because that's what I like to do. Thank you guys very much, and have a fantastic day.